I think there's also a lot of confusion as to when women should go and start their screenings. And if you can maybe start with us there, as well as how is it different from what the United States Preventative Service Task Force guidelines are saying?
Yes, I'd be happy to. You know, Lisa, most women think of guidelines in the context of three different ways that we find breast cancer. Through breast self-examination, or women finding cancer themselves, through a physical examination that they routinely receive from their doctor, or most importantly, mammography. The American Cancer Society historically used to recommend breast self-examination, and now we do not. We simply recommend that women maintain a heightened awareness of what's normal for them. Beginning around the age of 20, women especially need to just be sensitive in the course of bathing or dressing, or just be alert to any changes that they feel. Breast cancer is still very uncommon before the age of 40, but it does occur. And so during this period between the ages of 20 and 40, we recommend that women be alert to changes and that they get a clinical breast examination at the time of a checkup from their doctor at least every 3 years. The Preventive Services Task Force feels that there's not sufficient evidence to endorse physical examinations, and so they do not. They don't necessarily counsel against them, although they do counsel against breast self-examination because of concerns about false positives. But I think most important, and perhaps what your listeners most want to hear about, are the mammography recommendations. The American Cancer Society recommends mammography every year beginning at the age of 40. And of course, for women who are at very high risk because of a known mutation on a breast cancer susceptibility gene, or a high probability of one, we recommend that they begin annual mammography and magnetic resonance imaging beginning at the age of 30. We also recommend that women continue annual screening with mammography as long as they are in good health. Essentially, that means as long as they would be a candidate for treatment if breast cancer was detected. The task force, in contrast, recommends beginning mammography every 2 years at the age of 50 and continuing until the age of 74. They do not recommend mammography between the ages of, well, let's just say they don't recommend routine mammography between the ages of 40 and 49 because they felt that there was insufficient evidence to reconcile that benefits exceeded harms. And here harms principally refer to the occurrence of false positive test results. And they also do not recommend mammography routinely after the age of 75 because of limited longevity. The average longevity after the age of 75 is about 10 years. But on that particular point, that's an average, and that means that more than half of women are going to live longer than 10 years. And frankly, there's quite a few very healthy women ages 75 and older. So again, our emphasis is not to withdraw preventive health measures just because someone has reached the age of 75, that as long as they're in good health, they should continue getting screening.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.